October is Breast Cancer Awareness Month, and it's one of the most prevalent and well-known cancers affecting women in Nigeria, with some experts now saying it's likely to become an important public health issue in the next millennium. I'm joined by consultant oncologist, NSRA Luth Cancer Center, Dr. Emmanuel Temitope Andero. Dr. Andero, thank you for joining us on the program this evening. Cancer causes more than 70,000 deaths per year in Nigeria. Let's begin with why you think breast cancer is estimated to have the highest incidence among the rest. What's responsible for the increase over the years?
Good evening, and thanks for having me around. Globally, breast cancer has been recorded to be, the most common. Talking about cancers generally, and even, of course, among cancers known among women. And the causes, like we do say, generally are not known, but we do have risk factors, which, of course, who accounts for why we have, the increase in the rise of the incidence of breast cancer. And aside from the common known factors, ranging from genetic factors, from inherited what we call mutated genes, to family history, and of course aging as one of the factors, because as we age, the tendencies for the cells to repair damaged cells, of course, the tendency reduces. So the rise could be due to, of course, the change in lifestyle, exposure to, more of carcinogenic agents. And of course, did you know that the lifestyle too, it does play a role? I mean, being very active or inactive, and as it affects other factors such as the reproductive life, like talking about, instances where, we have the age at which a woman, nowadays due to job, combining career with family, having a first child at later age, increases, the risk. It's been known that women having their first pregnancy later than age 30 increases their risk. Of course, it is a risk factor, like I said, it's not an absolute statement. And being able to breastfeed, which of course could also be challenged by, being very busy, combining work with, family, raising children and everything. So we know exclusive breastfeeding to kind of confer some benefits to women. So we have quite a number of factors.
And that's a little bit scary, Dr. Andero, because I listened to you rolling out a long list of risk factors. And, one would think that over the years, with latest research into the causes of cancer, we'll be able to streamline, because it sounds so much like any woman, in her middle age could easily fall within this category.
Yeah, absolutely. Absolutely. Yeah. So, like I said, these are known risk factors, which of course are not absolute, in the sense that having these factors does not necessarily mean a woman will come down with breast cancer, but it increases, the risk of having breast cancer compared to an average, population.
All right.
Right.
So breast cancer is much more common in women, but I also know that it can affect both women and men. Is there anything you think that men should know about this before we move on? I mean, awareness among men seems to be lower.
Yes.
Yes.
Yeah. Well, contrary to the general belief that breast cancer, seems to be an exclusive disease of women, we do know that about 1% of men, 1% of cases are found among men. I mean, about 1% of breast cancer cases are found among men. And maybe that is the reason why, because of the low incidence among men, so people tend to think that it's only an exclusive disease of women, which is not so. Now, I guess that is the reason why sometimes some men also present very late, because the last thing that will come to the mind of a man is breast cancer. Should they observe certain changes around, the breast area? But I think, we should begin to, talk about breast cancer among men, even as much as to talk about women,
So
as
are men
well.
also captured within the breast self exams? Can men examine their own breast in this regard?
Well, absolutely. Well, I guess the reason is just because of the difference in the anatomy. I mean, in this case, you and I, of course, we know that the breast mass in men is absolutely not as pronounced or prominent as we find among women. So probably it doesn't allow men to really see or discover or even imagine whatever they find around the breast could in a way related to breast cancer. But of course, it's something that a man should pay attention to. In the event of noticing anything suspicious, it shouldn't be, pushed aside with the back of the hand or call it all kind of names. I think every man who notices anything strange or different around the breast area, either in the course of having his bath or whatever, should please go to the hospital for further evaluation in order to rule out, breast cancer, which, like we said earlier, is also found among men.
So for most women, they're always waiting to feel a lump in the breast before taking necessary steps. Are there other symptoms of breast cancer besides a lump in the breast?
Absolutely. Aside from, the lumps, which is, of course, seems to be the most common findings, yeah, we do know other symptoms could be kind of not so pronounced, ranging from a swelling in the armpit. I mean, some present in some atypical ways, swelling in the armpit, nipple discharge, which could be kind of bloody discharge, or skin changes around the areola. Areola is the black color around the nipple. And there are times when some could look like eczema around the nipple area as well. So, so that is why there has to be this breast awareness, as we call it, whereby women should be very pretty much aware of their breast and should be able to tell at every point in time when there are changes. Like I said, not necessarily, due to lumps in the breast, but just be due to those changes, skin changes. And sometimes, what they notice might just be some skin changes similar to the peel of an orange. We call it peau d'orange. So, and in this case, sometimes there might not be any lump in the breast. Of course, like I said, lump in the breast seems to be the most common. But anything that is different from what is the normal appearance to look like should raise the suspicion, and such an individual should seek for expertise opinion in order to rule out the possibility of breast cancer. And as we say, the major factor to surviving breast cancer is early detection and seeking for appropriate care.
So you've talked about what the individuals can do. There's now what the structure offers, and what the country can do, and what the current situation is. Cancer is life-threatening, but the reason why people dread it so much is the non-affordability of the treatment. So let's talk about funding. How well has government been able to subsidize this?
Well, to begin with, I must commend our government, both at the state and federal level, at least in their own little way. There are efforts here and there to subsidize the treatment of cancer, even though I must be quick to mention that we are not there yet, and we still have a long way to go. Every society where you have, very active participation and, good results from, managing cancer or any similar diseases, there has to be an active participation of the government. Individuals cannot do it alone. So there has to be a robust program. Right from, screening, specifically, talking about mammogram for breast cancer, for instance, there has to be a program all the way to detecting, early detection, and then through, being involved in, like running, relevant investigations. And like we know, prices of things are skyrocketing day by day, making it very, very difficult for an average individuals to afford, and all the way to managing the cancer, and even as it affects follow-up. So we still, expect our government, both at the state and federal level, to, collaborate. That's the word.
So what's the fate? What's the fate of an average Nigerian, for instance, who is possibly maybe not even in the middle class? If such a person has cancer, what options do they have?
Yeah, I must, mention that it's actually not very encouraging, as we see in our practice. An average Nigerian find it difficult, to access, medical care, and the program on ground, like talking about NHS, for instance, many, such programs don't even cover the management of cancer. And we live in an environment where, an average Nigerian is struggling to feed. Even for some to pay for consultation is a challenge. And then the price of these medications are skyrocketing day by day. And this impacts the survival of this, disease. And by so doing, so we have many people dying of this disease, in part because of affordability, of this care. And, for some, it is a communal effort to be able to, put all the money together, and some of them could barely afford to pay for, maybe the first two treatment.
It also speaks to why, for instance, many Nigerians would, want to explore alternative, Medicare in this regard.
Yeah,
yes,
absolutely. We also live in an environment where our sociocultural beliefs they kind of play a role in the way we manage certain conditions, where we sometimes attribute spiritual to the ailment that people have. And by so doing, where people do not have the means of assessing, the, modern healthcare, so to say, or going to the hospital. So they easily resort to using herbal concoctions. And then, of course, the results will not be the same. And as such, when many of them present at the hospital, we're talking about diseases that are already terminal, stage 4.
You know,
And
the perception, doctor, is that once you have cancer, it's just a matter of time you're going to die. And unfortunately, you
absolutely.
also get that vibe even from medical doctors, especially for those who are in the advanced stage. Is that the case in reality?
Well, I must say that there is a little bit of, a truth to that. I'll be quick to say that when we talk about malignant diseases generally or cancers, we talk about managing these conditions, right? And there is some peculiarities and uniqueness with, this terrible disease called cancer, in that, there's a common denominator to any cancer found at any place, and that is the tendency to spread, right? And then, we talk about stages of these diseases. Of course, for those who come very early, we do know that the potential to survive is there, but even so, being cured is not guaranteed. And then you now look at cases coming at stage 4. At this point, it makes it very difficult, and the prognosis at this stage is very poor. And we are talking about some cases that will just come around and then commencing their treatment, and in a couple of weeks to months, they're already gone.
I get you, but
Right.
what
So,
what what then is the what best practice in this regard? Because we've had complaints where people come to hospitals, particularly government hospitals, maybe in an advanced stage of cancer, and the attitude they get, from health workers is such that your case is condemned. You're not priority. You might not even be admitted. It doesn't matter how much pain you're suffering. What should be the standard on the part of medical personnel to attend to people in this category?
yes, I quite agree with you. These are some things we encounter, in our practice. I mean, I'm talking about centers across the country, and those are some of the reports that we get from some patients as well. I must give it to our own center because we are patient-oriented, and because there is a part to the management of cancer, which is psychology. However bad the case might be, the approach of the healthcare giver is not to condemn or to write off or make it look as if, okay, oh, your case is a write-off, and then, well, this is a death sentence. Even though at the back of your mind, of course, most of our patients, they present very late, but coming to the hospital is not to make it look as if, okay, well, you are just coming by this time. Where have you been? Oh, we are sorry. You are going to die in a few days, in a few months. So every health care giver should be able to look at, the whole patient. You look at the medical part,
And
the
then,
psychological part, and then your approach to be such that will give some hope to the patient, irrespective of the situation.
all right.
Right.
So,
And
doctor, we
I think
we have to wrap
we
up in a
we
few
see hope
minutes. If you can hear me, Dr. Adero, we have to wrap up in a few minutes, but I want you to quickly address some
yes,
misconceptions
please.
surrounding cancer. Some would say antiperspirants and deodorants cause breast cancer, and that an X-ray can also cause breast cancer or even spread it. Help us understand what the truth is in this regard.
Okay, so let me start with the X-ray, which is a form of radiation. One of the known risk factors for developing cancer is radiation. especially for someone who must have had radiation ID, maybe earlier days, like some people must have been treated for what we call lymphomas, right? So the potential for developing cancer is there. However, it depends on certain factors, maybe the number of exposure, when exposed to, the radiation. But that said, even radiation, the X-ray too has its own benefits. Like when women go for mammogram, for instance, what is being used is a form of radiation. Radiation too has its own role in, arriving at the diagnosis, the imaging. So radiation in itself is not entirely, bad.
All right.
Now, it depends on the amount of exposure to radiation. Now, talking about the deodorant, so one thing I tell my patient is to be very wary of the kind of product they put on their body, because everything will eventually find its way into the body. And some are leading with certain chemicals that the body might find so difficult to clear off, and some could be carcinogenic.
Wow.
So I think, everybody should just be wary to what they put into their body, because eventually some who have, a certain synergistic effect that could trigger off certain changes in the body.
All right.
That could, ultimately lead to, cancer in one way or the other. So the watchword is to be very careful in whatever, as it affects your food, the chemicals, and, exposure to, other similar agents.
Thank you, Doctor. I'm afraid that's our time. Consultant oncologist and SIA Luth Cancer Center, Dr. Emmanuel Temitope Pandero. Thank you for sharing with us on the program this evening.
My pleasure. Thanks for having me.